Hello, this is Kelsey Moore. Welcome to my presentation on cystic fibrosis. Cyst, meaning gallbladder or containing cyst, ick, pertaining to, fiber, fibrous tissue, and osis, abnormal condition, cystic fibrosis. Cystic fibrosis is a genetic disorder. It's the number one fatal genetic disorder in Caucasians, especially of Northern European descent. So here's a little graphic based off a foundation in Canada. So there's a lot of stuff on here that is pertaining to the benefits of what they have done through money earned as far as our foundation goes, which is amazing, but you can go ahead and look at that. That's not the point of the slide. Center top, what is cystic fibrosis? We are going to cover all of that in here, but ultimately it is primarily a respiratory and digestive disorder. It's from mucus buildup causing all sorts of havoc. All right, our top blue little bubble in the top right is 1 in 25 people carry a defective gene for cystic fibrosis. For example, my uncle had cystic fibrosis. My uncle and my mother do not. I'm not sure if they're carriers or not, and that is what that means. 1 in 25 people carry the defective gene for CF. I am a carrier, but my sister is not. We got tested because we both have children, and just knowing that if you have someone in your family that has cystic fibrosis, obviously you can deduce that genetically there's obviously a potential that you have that. From what I know, if both parents, you have to have both parents have to be carriers in order to have a child that has cystic fibrosis. So, for example, obviously, both of my grandparents must be carriers. They must have carried that gene. And not necessarily them. They came from smaller families, but my great-grandparents came from large families. And actually my grandma's had a brother that died when he was 2, and they at the time said that he died from pneumonia, but it probably was cystic fibrosis. And then their parents, had 10, 12, 16 kids, lots of kids, and not all of them lived into adulthood based off, pneumonia or some other reason that very likely could have been cystic fibrosis. All right, so now moving down, CF patients take about 30 pills a day. That obviously increases if they happen to get any sort of a transplant. Typically that's a lung transplant, but 30 pills a day just to live a relatively normal life. And yeah, that is definitely subjective to them obviously still having a number one fatal genetic disorder. So normal is relative. For example, this little third bubble down here says, imagine breathing through a straw your whole life. I think much of my childhood, I went to fundraisers and foundations, and typically they did have us breathe through a straw just to kind of get that across. And that is only the one aspect. That is just the lung capacity aspect of it, let alone the overflowing of mucus within the system and all of that we are going to get to. All right, life expectancy per this infographic in 2013 was in the 70s. They put this number as 6 years old, and now, or as of 2013, it's almost 50 years old. That is incredible. There is still no cure for cystic fibrosis, but there is treatment and just new awareness, new ideas. So, for example, my uncle, when he was born in the early 70s, his life expectancy was 4 years old. He died in early 2000s at 38. He had, there's obviously a spectrum with the severity of your case. I think his was relatively normal, and he lives in Colorado, which doctors encourage, and cystic fibrosis patients find relief when they live in dry climates. You just, again, if you think about this as a mucus, the problem is a mucus buildup. So, um, yeah, living in a drier climate tends to help. So yeah, I think that's just absolutely incredible that it has gone from 6 to 50 years old. Keeping in mind that is relative based off where you live, the severity of your case, so many other things, and access to treatment. All right. So, like I said, this is a genetic disorder. So, that's the cause. Um, the genetic mutation causes fluids, just kind of an overgrowth of fluids within basically all of your systems. It's a thick and sticky mucus, and that clogs your ducts and passageways in the body. Detection. So, as I mentioned, my sister and I did genetic counseling, and so we found that out before, we had children. But if you did not, there's always two options once you're pregnant. Typically, cystic fibrosis, you could, but I think it's more if you're at risk for other genetic disorders and you want to know. And just for preparation, when the child is born, if you know that it has cystic fibrosis, you can start making those plans. So, two ways to do that is amniocentesis. That is a puncture into the amniotic sac where they pull out and then test that sample. There's also the chorionic villus sampling, and that is from the umbilical cord. You can do that one as early as 10 weeks. Amniocentesis, I think you can do that at any point in time throughout the pregnancy, but it does carry its own risks for that. So kind of have to weigh that. Diagnosis. So again, if you can do that in utero or later. Typically, children are diagnosed relatively early in their life, but some are much later. I have a friend, her daughter was diagnosed when she was, I think, 3 or 4, which is pretty late in the game. Her case is by no means mild, but I'm not sure necessarily what led to them not having the testing available or why she was diagnosed a little bit later in life. All right, multiple body systems are affected with this disease. Like I said, every person is different. My uncle's was definitely more in his digestive system than his respiratory system, but he did have a double lung transplant. So again, this is not a light disease. This comes with lots and lots of issues. If you look at the little graphic here, you can see how it truly does affect the entire body systems. You can go ahead and just look at that. Okay, so again, this is a genetic disorder that is ultimately causes mucus, and that is why it affects all of the different body systems. It's basically coding your body's natural ability to function one way or another. And so if you look here, you have, as far as in your sinus and your lungs, will start from the top of your body and go down. Lung infections constantly. So when we get a cold or whatever, obviously the CF patient struggles with it much, much more, let alone when mucus builds up just, seasonally or whatever it is, it takes over, and then bacteria and infection can take over. Glucose intolerance. So I think this is something here. I don't recall my uncle I don't recall him eating much gluten, but also I don't recall him having that. So that was in the early 2000s. I think a gluten intolerant or gluten-free diet is relatively new. So I think that that's just one of those other things that there is awareness and functionality that helps with treatment. Obviously, these are why the pills as well, deficiencies of your digestive enzymes. So you're not absorbing the nutrients as much. So that enzymes are a main component of the 30 pills that the average CF patient takes throughout a day. Intestines, again, same thing, low nutrient absorptions, and typically fatty stools come through here. Liver, typically there's cirrhosis, just chronic infection. Men are typically infertile, and by typically I mean like nearly 100% of men are infertile, just because there's again, the mucus blockage. We'll get into that. I have a page on that. And another test, this doesn't seem very grounded or very scientific, but if they have a salty perspiration. So there is that. So multi-system, mucus everywhere. And there are these that are more internal, but still obvious to maybe the public if someone has cystic fibrosis. But here in the description here, they also have cyanosis, which they kind of have a blue tint to them, especially their teeth. That is a combination of taking all of the pills. There's a lot of steroids that are in the 30 pills that they take, so that is seen in their teeth, but also just the literal lack of oxygen that they have in their body gives a blue tint, especially to their nails, but even sometimes their skin. And that does go up and down. They don't always have a blue cast to them. It's when they're especially struggling with oxygen, which might not be all day, every day. All right, so again, this nutrient malabsorption is kind of an issue here. So people with cystic fibrosis tend to eat, well, my uncle did. I'm realizing that maybe wasn't the best treatment, but a high-fat diet, just because it's hard and very nutrient dense. So a lot of those fat-soluble vitamins, because their body is not absorbing them as well. So typically they eat a lot because one of these components is it's hard for them to gain weight. Okay, so these are the three main organ systems that it affects, and we're going to go through them one by one. All right, respiratory system. This is just a list of our medical terminology words. So there's chronic cough, chronic tussis, coughing up blood, which is hemotysis, collapsed lung, which is a pneumothorax, rounding and enlargement of the tips of the fingers and the toes, which is clubbing, and that is signs of hypoxemia. So that's what I was talking about with that blue tint, but also, yes, a rounded of the fingernails. Frequent lung infections with a thick phlegm, which is a pulmonary infection with accompanying sputum, heart enlargement with it, which is cardiomegalia, nasal polyps, shortness of breath, which is dyspnea, and inflamed nasal sinuses, chronic sinusitis. All right, starting with chronic tussis. There are some videos here. I couldn't possibly do them just because it is very, I don't know, uncomfortable, nerve-wracking, intense. But if you just Google a CF cough, typically most of them show you how some of the breathing treatments that they have to do multiple times throughout the day, but it causes a coughing fit, because the whole point of these breathing treatments is to break up the mucus and then they cough it out. So again, this is just a horrible disease. So the chronic tussis, there's a lot of mental, emotional issues that come with this. If it's a child in, second grade and they get a coughing fit through class, it's just embarrassing, and they can't breathe, and it's scary, and it's just a lot. So it is excessive mucus, so it's a intense cough. It can sound with a little rattle in it. I feel like even CF patients, you can tell by their voice that they have it. They are chronically hypoxic. So they have a shortness of breath, which is dyspnea, which is noticeable when they have that coughing fit. So again, just for education and awareness, and I'm sure if you're taking this class, the likelihood that you're going to be around somebody at some point in time that has cystic fibrosis, I do think it behooves all of us to watch those videos of a CF cough, just for awareness. So the first time you hear it, maybe you're okay with that. So the chronic tussis, I remember cupping was one of the breathing exercises that I became familiar with growing up, just because sometimes he would get into a coughing fit, and being able to tap his back. I mean, it was not tap, it was a slap on his back, just through routine. It's called cupping. Helps break up that mucus so they can go ahead and have that productive cough, getting that mucus back up. And again, so Google CF treatments, and so you can have just a little understanding there. Pulmonary infection with accompanying sputum. So I think this is a really great graphic to show why there's so many infections, why that's an issue. It's just they're clogged up all the time throughout their pathways, which causes damage to the lungs, which also makes you more susceptible. So it's just kind of this nasty positive feedback. This is what I was talking about with their nails. So see how they're rounded. They're typically blue. So these are the signs of hypoxemia. So it's the arterial blood that is low in oxygen, but ultimately, because their entire body is. So yes, their nails are typically blue. Like I said, it's not always, it's not constantly. They are constantly hypoxic, but maybe not to the point of it being that obvious. Okay, moving on to the digestive system. So ultimately, it mostly affects the pancreas. Again, this graphic here just shows that it is an overgrowth of mucus, which decreases the production of those enzymes, which is why they typically eat a lot with a high fat, high protein, densely nutrient dense with those fat soluble vitamins. And so here, some of the hormone cells in the pancreas can be destroyed, which may lead to a glucose intolerance and type 1 diabetes. There's also a bowel obstruction. So there's two kind of main phrases of that. So 1 in 10 babies born with CF develop a bowel obstruction called meconium ileus at birth or within the first 2 days. So it basically is just a very mucousy stool, and typically through surgery or something that is taken care of. It's an ongoing issue, but it's not chronically severely ongoing. Then there's distal intestinal obstruction syndrome, DIOS, previously known as meconium ileus equivalent. It is unique to CF patients. Again, there's an obstruction in your small bowel causing stomach pain, bloating, nausea, and weight loss. This is long term. This is throughout basically your entire life. Again, one of the other 30 pills that they're taking is to help with that, and a diet. All right, we're still in there. Gastroesophageal reflux disease. So that is acid and non-acid contents of the system move in the wrong direction. So just a lot of, reflux coming back up. So this is also GERD. It's more common in CF patients because of excessive coughing, obstruction in your lungs, and lung disease, delayed emptying of the stomach, a high-fat diet, and the VAX valve at the bottom of the esophagus, and other CF complications. So just they're really up against it. There's multiple reasons why they end up with this. Also, there is no cure, only treatment. Um, so, treatment to reduce the GERD before a lung transplant. So, that is part of it. That can improve with a lung transplant. But it's also because of this that is one of the reasons why the contributing factor is to a lung rejection. So ultimately, my uncle did have a double lung transplant. He lived with that for, I think, a year and a half, and then ultimately died from infection and rejection from the lungs, ultimately. Long story short. All right, reproductive system. So, men, like I said, typically all men are infertile. A lot of women are, but not all of them. So, it's kind of the infertility, the way cystic fibrosis affects the reproductive system is different in women than men. So, theirs is just the mucus makes it more difficult for the fertilization to happen. Also, if they're low weight, and ill, they just miss their periods, they're not ovulating. Men, their connection between the sperm and the semen are not connected, and so they're sterile in that sense. There is a way you can, through in vitro fertilization, there can be ways around that through fertility treatment, but it's not entirely foolproof. Obviously, there's still might be some complications in becoming the biological father of your child. All right, so as we've said, there's no cure, only treatment. So here there are a lot of breathing exercises. I have the link in here. I'll probably just post the actual presentation here without this version so that you can click on these links and watch these. The three most common breathing treatments are the clapping method, so manually, as well as a vest that they wear that basically shakes their lung, and then the acapella is more like a handheld thing that they breathe through that rattles their lungs, and then that produces that productive cough. So like I said, they typically do that every morning, and then every night at least, and then oftentimes throughout it. There's also physical therapy, chest physiotherapy. So any of those respiratory therapists are going to become very familiar with this. All right, what can you do? I suggest your Amazon Smile account. That's a very passive way to contribute to a foundation. The Cystic Fibrosis Foundation is a main foundation. It's really great. They're doing lots of awesome things. More of a local foundation. This is Attain Health Foundation. Both of these are on Amazon Smile if you want to find those and just contribute to them that way. They're doing really great things. The Attain Health, that is my friend. She lives in Red Lodge, Montana. So more of a local one, I guess, in that sense. All right, so how you can help. I think just bringing awareness, watching those YouTube videos, as painful and uncomfortable as they might be, it really gives you some sympathy and understanding and a respect for this disorder. So I just encourage education. First and foremost, educate, become aware, and then go from there. Everyone will find their place in what feels best for them. And this video is really amazing. Let's see if I can watch it through here. No, we can't. So this is a YouTube video. I just absolutely love this. This is a CF patient that is waking up after a lung transplant, and just her amazement at being able to take a full breath. It just really shows just that idea, if we're breathing through a straw, how labored that is. And that's their whole life. She got this lung transplant And as she's taking her deep inhale, you can just watch her feel like, oh my gosh, my lungs are, it's this breath is just so vast and unending. So it's very moving. You should watch it. Like I said, I'll attach the PowerPoint here that is at your feeling. So thank you so much for hanging with me. And I'm excited to watch all of yours.